One second. Open Zoom. Yeah, open Zoom. एक second.
You can unmute your. I will give you a request. Just a moment. Ma'am, can you unmute again?
You say as.
Okay. So we can start now. No worries, ma'am.
All right. Can you see my PowerPoint?
Yes. Thank you. So as you know, PMM have taken 2 sessions which were very excellent. You can see it in the beautiful topic of pain remedies. This is we planned it in the last month. Miss from Pune, and she had trained under Dr. Rajan Shankaran and Shorten, and first psychiatry modules at TOS, and last year did her FHPC, and she created the Vitalia.
Amazed at the enthusiasm that Dr. Deepu has. He always coordinates and he's very helpful. Thank you so much. So let's begin today's. Before we begin, I just want to Praful Vijaykar. He's an extremely inspirational speaker, teacher. As a community, I think we must pray for his the soul, and that I hope that wherever he is, that he's pain-free and that he's he's in managing, and they're given, I would say, with the homeopathic medicines are far superior. So now one of the things that is happening currently is in this situation is that senior citizens who have dentures or who have gum troubles and who have it's very common, they are not able to go to the dentist. Okay, but some issue has happened, something has happened, tooth extraction, something needs to be done. This fear is there. Okay, so as I said, these are some of the remedies that we will be seeing: Aconite, Arnica, Ranunculus, bulbosus, Calendula. We cannot work without Calendula. Calendula, I think we are probably using it 10% of its usage currently. We should really explore how Calendula can be prepared, used, what are the other areas where Calendula can be used, and extremely important in a lot of the current situation. Even was important before, but now currently I'm this list has been prepared with view to this lecture only. So it's not by no means it's a complete list, because as and when you are using it in your clinic, you see how it is useful, you come across a remedy, you read the materia medica, you read your pathology, you can keep adding to this list, but this is like a sort of must have list. There are many remedies in this which are not, the cases are not there probably in this presentation, so those remedies are not included, like Nux vomica, very important remedy. Ignatia, again very important remedy. So Tarantula cubensis, R-salve, without R-salve nothing is possible again. Pulsatilla is one of the other remedies, again if you'll notice is not here, but we know it's extremely important in your senior citizens. They're weeping, no cause is there, you feel like comforting them. Again, lycopodium is not here. So like I said, this is by no means a complete list. Belladonna. Belladonna has, again, we are probably using 10% of what the sphere of action of belladonna is, the conditions that it can be used in, the efficacy, the different potencies. We generally use in 30, and generally give single dose and see couple of hours, because now again the sphere of action, the rapidity of action is very fast. Bellisper, a very very important remedy. Rust tox, Sina, Chamomilla, Mac Carp, Staphysagra, Hypericum. Again, Hypericum is something that I am never without. Ladum Pallister as well, again not in this list, but one of my favorite remedies. Curcuma. Curcuma longa, we just again, when I went online, when I went to prepare for this lecture, when I was reading about curcuma, I was amazed. Some of the studies that they're doing currently with curcuma longa. Does anybody here know what is curcuma longa? Can you put it up in the chat? Can I see the chat, Deepu? Where is the chat? How can I see it? Curcuma longa is a very, very important remedy. It is turmeric. Okay, so it has been potentized. You can use it. They are doing studies currently to understand what is there in curcuma longa that is useful. As Indians, we can never cook. South Indians, we can never cook without turmeric. Okay, haldi doodh at night is a big. It is a. I think it's a tradition in many households. So we have to understand where these remedies, some of these remedies, are part of daily life. Somewhere, because this remedy has always been there, we are not looking at it. We need to understand curcuma longa, very very important remedy for your patients, as a support remedy, I would say. So okay, going to the first case. Are there any yeah, haldi, yeah, correct. So, yes, but we have to understand now curcuma longa from the pathology and from the active principle, from the where it is in the plant chart, how it is related to those remedies, how we can use, how we are not using. So, as I said again, I at least find that I'm using probably arnica or calendula or curcuma, maybe 10%, belladonna, maybe 10% of its potential. So I'm very happy to reacquaint myself with remedies that I think that I'm using very well, and then discovering that in fact there is a whole world of opportunities where we are missing certain remedies. So, all most of the cases today are acute cases where we have to immediately do, we have to see, we have to have quick follow-ups. Maybe in like an hour, hour and a half, we have to have the follow-ups. We have to understand what's happening. This is a 50-year-old female patient who called me suddenly in the morning. She said there was a noise at night. Maybe some cats were fighting. Maybe some screeching noise, some loud noise was there. Very recently, this was last week, and I suddenly woke up. And when I woke up, I couldn't understand where I was. There was a sudden noise, and I just froze. And I feel that I'm not able to move. Something's happening. Although I'm moving, it seems to be that I'm on autopilot. I'm alone at home. Children are somewhere. My husband is traveling, and I feel that there are chest pains. And when she called me, it had already been 4 hours that she was on this, because this happened somewhere around 1 o'clock or 2 o'clock at night. And I said, so what happened immediately at that time? So she said the heartbeat was super fast, and I was just looking, like that, and I couldn't understand where I was. I was trying to move. I was literally frozen in one spot. So she says that I thought maybe it is a cardiac event. I was just waiting for the heartbeat to settle. And then when I could move a few hours later, slowly I moved, and then I could do something. But even now I'm not 100% myself. Heart symptoms are still there. I feel there is some sort of uneasiness. And because it was a Sunday morning, I can't reach any doctor. I can't get an ECG done. Not hypertensive, on my treatment, constitutional remedies going on, but this is something which has come up suddenly, acute on, which has come up as a acute situation. So I asked her mainly what is the thing. So she says it's a fear. I don't know what happened. Suddenly something happened on the street and I woke up. And I don't know anything more than that. So I took the cause as shock. Older patient, comorbidities we know. Sphere of action was circulation, as I understood. Some uneasiness in the chest. Pace was sudden. It was already 4 hours, but still she felt that something needed to be done. I am still in that phase. I am not come out of it, she said. So, immediately what is the remedy. This is a very favorite remedy of mine for sudden shock, and it acts very fast. And so it was given. Aconite is the remedy. It was given. And a few hours later, 1 hour later, she called me. She said, already I feel big change. I'm coming out of it. 1M was given. And she said, I think I'm going to settle down. So I said, if anything like that, you feel that either the heartbeat or uneasiness or something is happening, you need to take it before you message me. Take another dose. So what I did this time was, because I know that Aconite works very fast, and I told her to prepare a solution, 3 4 pills in like 100 ml water. Take, dissolve it very well, keep it covered, and take 1 teaspoon and message me in 1 hour. I said in 1 hour. She said already much better. And I don't know what it was. Now I think that it was probably some cats fighting. There was a loud screeching noise, and then later on she described the whole thing. She had become unfrozen. So when the shock happens, especially in this current situation with a lot of fear is there, and you don't know, and suddenness is the main keynote, you have to see, and then you have to make sure that whenever it is immediately possible, that at least a ECG is done, because you know that if they have a cardiac condition already, that your you need to just be absolutely sure that they are out of whatever event it is. So in her case it was just like a shock, so she came out of it. A day later again some sudden noise was there. Again she was woken up, but she said this time I could see that I was not in that kind of frozen like yesterday. But again a dose of the same solution was repeated. So this is now 10 days since that. Now that these symptoms have not come back again, but I'm waiting. In another week I will have a follow up with her, and we will see whether we need to repeat her constitutional, and which is completely unrelated remedy. So I was also very surprised, because normally previously, last year, up to last year, I would have repeated the constitutional. But now, the senior doctor on our panel, Dr. Balvinder Singh, also says that the present persistent pathological symptom is a thing that you must deal with immediately now, because this present situation which is there is asking for that present persistent pathological. They cannot go out. They're stuck at home. There is an atmosphere of fear. There is an atmosphere of anxiety. So all these remedies are coming up. Okay, so this was again one more case of aconite. Like last time also, I had presented. I had shown one case of aconite. So this was in an older patient. Second case. So this patient, older patient again, um, almost in the 80s. Okay, heard that the neighbor in the one floor below or 2 3 floors above, someone had got COVID positive, and was an younger person than him. So this patient is an older patient, almost in his 80s. So when he heard that, he within that night or even before, he developed some sort of eruptions. Initially, one in the corner of in the angle of the nose and between that and the mouth, and rapidly went inside in the nostrils, both this side, the lip, upper lip, middle, all over here. And I have photographs. Unfortunately, I'm not able to pixelate it myself and cannot share it on Zoom because of privacy issues. But very quickly it spread inside the mouth, or in on the gums, on the soft and hard palate, almost near the throat, all the way here. In the this inside the ear canal, corner of the ear, in the scalp here, and at the back, and was now going towards the neck. So what had happened with this person was, just that week, they had gone to the dentist, and extremely painful. These eruptions were, cannot touch. They're kind of a dusky, reddish bluish, various sizes, not purulent, but cannot be touched at all. He could not sleep. He was extremely restless, because this is the danger area of the face. All the venous sinuses drain into it. So not even in, not just in the skin, but mucous membranes also were affected. And of this entire thing, corner of the eye here was also affected. Corner of the eye here was also, of the right eye was also affected. So skin and mucous membranes were affected. And because it was so rapid, and because that week they had been to the dentist, the first thing that they thought was that it is something that is picked up at the dentist's office, because he had gone for a root canal. Now, in current scenario, unless it is a dire emergency, I would not advise the over 60 age group to go for any dental process or procedure, unless it is complete emergency. It's better to give them pain relief, better to give them arnica or calendula gargles and things like that. Take care of the tooth, take care with coffee, and tell them that wait for a couple of months, repeat the constitutional also, and make sure that they are not going for any dental work, because although dentists are extremely careful, seeing only 3 patients a day, 2 patients a day, the very fact that this drill work, or is going in the bones, anything can seed an infection deep in your bones. In this particular situation with comorbidities, is extremely high risk. So 2 3 days had happened. They went to another doctor, they went to another dentist, they got a scan done, they got so many things done. The dentist was also not sure what was happening. And it was almost 2 3 days or 4 5 days later that they approached. Somebody said कि इसमें होम्योपैथी भी काम करता है, आप इनको कॉल करो. So this, till then, this poor man, almost 80 plus, had not slept. So it was extreme great pain. The pain relief, the painkillers, whatever the antibiotics was given, was not helping him. So obviously we had a video call. He could not even speak, he was in so much pain. This side was completely swollen, one side was swollen, and he could not swallow any food also, only liquids. So first of all, diagnosis was very important. So because it was the single side which was affected, and the facial nerve along that, and also I thought trigeminal also was affected. So along that, I of course said it is herpes. And but there was no way that we could, because of the extreme pain, and the presentation, this was what I thought. So, with this age, I was really wanting to rule out Kaposi sarcoma. But when I spoke to my senior doctor, he said that with this kind of presentation, I think that herpes is simplex is probably a very good diagnosis, which, the dentist also, none of the doctors had made it out, because they were not expecting this, honestly. So the patient himself was saying that there is a pain as if there is an ulceration. And the dentist, of course, thought that one of the instruments, the high speed drill that he had used, had actually probably caused an injury. And they were working on that diagnosis. And that the fact that maybe when he was doing a root canal, the gum had, or the bone had cracked there because of the age. They were trying to see whether they could get an X-ray done, and all those things. So in the meantime, I said, okay, this, because of the pain, because of the fear, and then which came out later, actually, in retrospect, that he had heard that a neighbor younger than him had got COVID positive and was very serious in the hospital. So because of that, that was actually the aggravating factor for him. So a remedy was chosen, and a single dose was given of that remedy. And if anybody can guess, it would be great if you could tell me what could be the remedy where the skin mucous membranes are affected. You know that in an older person, that you have to be extremely careful in this current scenario, that it should not go and affect the lung and the serous membranes and the pleura. and you also are extremely careful that that all this was there. Belladonna is a good suggestion, but remember, uh, although it was sudden, there was something that he had heard, and this came as a shock to him because he was a younger person who was affected. He was in his 50s, and was in the hospital. Pyrogen is a good suggestion again. Hypericum is also a good suggestion, but remember, skin and mucous membranes, not nerves, affected. So when you have aconite is a good suggestion again, but you see, aconite is in the pre-eruptive stage, not in the eruptive stage. Aconite is when the suddenness and the hectic and the fever and the first stage, it comes and goes like a storm. Arnica is a very good suggestion again, but you see what arnica doesn't cover. Arnica, curcuma is a very good suggestion. Rustox is a very good suggestion as well. I would have thought of rustox too. Acid nitricum is not a good suggestion because it doesn't cover. No, no. In fact, it's a very interesting remedy. Whoever said aconite and staphysagria are partly correct. I will tell you why. Because this remedy, please make friends with this remedy. Very, very important remedy, very simple remedy. 1 m, one dose immediately can bring relief to herpes. It's important to know this remedy, not ignatia, because ignatia doesn't cover eruptions. Hypericum covers injuries. Yes, Dr. Kiran, ranunculus. Which ranunculus are you talking about? Ignatia will not cover eruptions. Bulbosus, yes. Ranunculus bulbosus is your friend. Okay, please keep Ranunculus bulbosus 1 m in the clinic. Okay, you have these. I'll tell you especially what time, what scenarios. Something has happened. Okay, brother or sister has got hospitalized. Okay, now we have a 70-year-old. This is the background, and you will find the story happening again, 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 many times. Okay, uh, yes, one of the other remedies like pyrogen, I was thinking of multi-drug resistance, Staphylococcus aureus, MRSA. This is a potentized remedy. Please remember that, again, a friend of yours, if the patient goes to the hospital, has surgery, comes back, and there is a scar or there is something, there is low grade fever, not yet like pyrogen, but some eruption has come, and it is spreading very fast, there is pus, then MRSA, multi drug resistant staphylococcus aureus, most important remedy. You can give 1 m immediately, at least the pain and the spread will be stopped. Okay, pain here was much, much, much more, of course, because it was in the danger area of the face, right? So your venous sinuses, this age, has not eaten, has not slept, these are very, very important. The pain doesn't let you sleep. So when you say aconite has no eruptions. Staphysagria you will give when you will give when the, again, staphysagria, very important remedy, just keep it in mind. I'll tell you when you will give staphysagria. So Ranunculus bulbosus 1 m in water, because he could not even put the pill into the mouth. So much pain was there, excruciating pain. In water, 3 to 4 pills, 5, 6 pills you do. You put you crush it first with a spoon, put 100 ml water, keep it covered, give a spoon, full teaspoonful, just wet the lips, put it into the between the lip and the tooth. Immediately he could not eat. He asked for dal khichdi. That was the first sign that he was getting better. Okay, so you know that now potency is right, water is correct, water dose is correct. Then he slept in the afternoon. Then, most importantly, because I was coordinating with his daughter and he didn't know technology, he lived in another building. His daughter used to go in the morning, meet him, take photographs and come. First photo he sent where he was smiling, and you could see that the redness and the blueness had reduced. But still, because it was inside the ear canal, inside the nose, nostrils, it was on the hard palate, it was on the soft palate, it was on the gums, all these areas inside the nostrils, these are extremely painful areas where you have eruptions. You have to explain this to the patient. You cannot think that the remedy is not acting. First thing, what how do you know the remedy is acting is when the appetite improves and he is able to sleep. He's not so worried ki kya ho raha hai mere sath, is what is this, what is happening, am I dying? that comes down. Appetite goes up. He's asking, how are you, to his daughter? Did you eat? So the concern for the other. So that the pain is now manageable within him. And then he could even, so till then we could not even see inside the mouth what was happening, because he could not open his mouth because it was on the gum, on the inner part of the cheek. So then we could slowly take photographs, see. So now I didn't repeat anything. As long as the improvement lasted, I didn't repeat, because in an old person, almost 70 plus, I had given 1M. We have to move very carefully here. As long as the improvement lasted, I didn't repeat. When little bit pain, he said, or when he started saying burning has increased. Burning is one of the characteristics where you will again think of Ranunculus bulbosus. And this herpes, wherever it is, face especially, I've seen many cases. Corner of the eye, inside the ear canal, in older people, something is happening in the office, or like I said, sister, or older sister or older brother has been hospitalized, they cannot go and see them, they are worried, they develop herpes. So extremely useful. One of the other remedies my colleague recently was telling me was basilinum, where in these older people where circulation is very poor and they're busy, they're doing a lot of things, some every single cough comes, it settles in the lung. They have these kind of ringworm kind of thing. Basilinum is a very important remedy during this time, because simply because I'll tell you, more than tuberculinum I would think of basilinum during this time for older people, because it is made as a prime difference between tuberculum. What is the difference with basilinum, can somebody tell me? How do I get to the chat? Why we would think of, why we don't start with 30, you tell me? Because the pain was so much, he had not slept, he was extremely anxious. They had done 3 4 visits outside the house to do some cat scan, this scan, that scan. They were suspecting there is a fracture. And also the fact that he could not eat and he was diabetic. So I was very worried that at least he should be able, the pain should go down, he should be able to eat, at least follow certain things, because I was worried that it will, it will enter maybe the esophagus. It would be very difficult then in an older person. But his vitality, see, then in that case what I have to do is I have to trust that if the remedy is right, then 1M will work very fast. And that is why repeated doses we don't give. That 4 5 pills which we made a water solution was the only thing that we were stirring every time, and we were repeating if it was necessary. I don't think in 5 6 days I have given more than 4 5 doses. We followed up for 2 weeks. He had absolutely no issues. Slowly it went down. From inside the mucous membranes, first the eruptions cleared. Okay, but in the ear canal where the cartilage is there and the blood supply is already a little bit low, it cleared last. So we have to expect this. We have to understand that as long as he's sleeping, he's asking for food, he's asking how the other person is, we know that improvement is happening. And he was sending smiling photos every day. Now basilinum, why it is important in this present scenario, I'll tell you. With the fact that between tuberculinum, which was made with the sputum of the infected person, and basilinum, which was actually made from the portion of the lung, all the secretions, the bacteria, the secondary infection, that was the substance used to actually form the remedy in basilinum. So we have to understand extremely fine differentiation will come, that tuberculinum will probably be important for a younger person, but basilinum will be very important when there is a repeated lung infection, because it is made from a lung infection. So it is even more similar than tuberculinum. And where every cold settles in the lung, is an older person, cough comes 2 3 days, some change of weather, very restless, doing a lot of things, doesn't have time. So you'll see that kind of the nosode activity you will see. But this prone to skin infections, ringworms and fold of skin, extremely itchy, older person, low circulation, then the sputum doesn't come out. lung infections kind of thing, and you're worried that in this situation you don't want their lungs to get affected, Basilinum is extremely good remedy to remember. I generally give in 30 or 200. You can see the vitality, but I think 200 is probably, and in fact even 1 m is probably a better potency to be given in this time when you don't want risk. See, you can take the risk of probably of an aggravation, but you can't take a risk that the potency is not enough when the patient cannot come and see you very often now. And in older people, right now you're minimizing contact. We are not going and seeing our patients. We are relying on attendance, photographs, video calls, things like that, because you cannot put them at risk by going and seeing them again and again. So basilinum is very important under prescribed remedy. Again, a big friend of the homeopath. You have to keep it in mind. Somebody who's responded to natrum sulf, kali sulf. Maybe you're thinking of tuberculinum. You're thinking antium tart, like maybe antium ars, kali ars. You're thinking, but keep basilinum in the back of your mind. You have to prescribe this remedy, because simple fact that it's made from the diseased lung, the secretions, all the bacteria which are there. So it is probably much more homeopathic to give in older people, where they cannot throw off that infection. So all right, so like I said, eruption free in 7 days, but I had told them keep watch for any cough or shortness of breath still, because that Ranunculus bulbosus has a sphere of action in the pleura also. Some cough and that pleural rub and it doesn't go and things like that. So you have to keep in mind that Bryonia, Ranunculus, bulbosus together, 2 3 remedies together. Keep in mind, keep that basilinum in mind. Maybe send, when you're sending doses, send us 1 2 3. Tell them ki acha ye agar aata hai, to keep this in mind also. So generally now what I'm doing is, when I'm sending remedies, I'm sending the next one also. I know that I trust what this remedy can do. But like I said, in older people it is far better to be safe than sorry. All right, going forward. um Now, same similar situation, like I said, younger person than before, but again in the 50s. Again, in the last month this happened. Some audit was in the office, something happened, he's working from home, recently just started going back to work, so already anxious about that. What is the right way to go to work? Should I wash hands? Should I carry this? Can I eat? Can I sit with the colleagues and eat? So anxious. Some scrutiny happened, some audit, some notice was sent, I don't know, some questions were asked. So he got a shock when he discovered a colleague had done some mischief with the accounts. So he came back home. He said, how could this be possible? And he could not eat. Within a few hours, again, face, right side, severe eruptions, corner of the mouth here going up towards the ears, not inside the ears, luckily. Extremely painful, cannot be touched, cannot swallow, cannot eat, VP, crying, don't know what's happening. And uh, again, what is the, um, where is the, 1 second. Huh, I'm looking for the chat box. So again, you can guess what could be the remedy, because again, similar thing. But where now I've added, why I put these two cases together is, you could see that something happened. Something happened at work. Okay, he was shocked. He came back home. He could not eat, and immediately eruptions came. Now you would think that Staphylococcus aureus, Dr. Divya, but then in Staphylococcus aureus, eruptions are not there. Staphylococcus aureus will get much more of a pain in abdomen, toothache, and maybe urinary symptoms. Okay, because the sphere of action is the most important. Without sphere of action, I will not move ahead. I will see if I'm even thinking of a remedy. I will think, does it cover the sphere of action? Skin and mucous membranes, little bit in this, but hypericum, why? There is no injury. Injury to nerves has to be there. Some penetrating injury to nerves has to be there. So see, if he had gone, some um, dental work was done. Okay, similar case again, not this one, another one. Dental work was done at the end of root canal. Something happened with the nerves, and then the pain along the nerves. Okay, then I would think of hypericum. Then I know that when you do root canal, you do know that the nerves have to be made dead in the socket and all of that. You will give arnica before they go for your root canal. The day before, that day before, you will give arnica 1 m. Then you will give calendula to them when the root canal is going on to prevent a dry socket. You have to tell them to do calendula mouthwash, don't gargle, all those things. Yeah. So ranunculus bulbosus again, because he came back, he was in shock, he could not eat, and of course I went ahead with the presentation, so you saw. So also what was happening with this person was he could not move his arms at all, although there were no eruptions there that I could see. He could not move his arms. And again, this person had a fear that it was a heart attack, so again I thought of ranunculacy. But because of the shock, which we came to know later, because when they're in acute, you can't ask कि office में कुछ हुआ, did you get this, did this happen, that happen. Just a presentation comes, you prescribe with that, then later on when the person is better, you prescribe. Again, in this case, similar remedy, ranunculus, same remedy, ranunculus bulbosus was given, not Staph aureus, because the sphere of action was skin and mucous membranes, not your, bladder or abdomen, where you would expect in Staph aureus, or you would expect maybe a sty to come, very big painful sty to come in Staph aureus. So I again gave ranunculus bulbosus. 1 m is the choice of potency, because 1 m is the one that will stop the ranunculus eruptions in their track. It will prevent further eruptions from coming. It will decrease the sensitivity to touch, because what happens if this main thing with herpes is extreme pain to touch. You can't have a bath, you can't sleep, you can't put a pillow, you can't put any covering, nobody can apply anything. It's extremely painful and tender to touch. This has to go. So 1 m again, 1 m again, water dose, again wait and watch, again see whether eating is possible, whether he's able to at least express what is happening, and whether appetite improves, is sleep is possible or no, because they lose sleep, you see, like Staph aureus, this entire ranunculacy, and going forward we saw the papaveracea also, they lose sleep. Sleeplessness is there because they cannot contain this. It comes inside, this event comes inside, they are not able to manage their circulatory system, they're not able to manage their nerves, they are not able to manage the sleep, because the disquietude, what they say, that quietening of the nervous system never happens. So because of that, Ranunculaceae, Papaveracea family are very important. They are your friends. You have to see, you have to keep it. Keep Ranunculus bulbosus in the clinic. Please give, please try, send feedback. Okay. So again, he had a fear it was a heart attack. You see, when this comes, this fear that it is a heart attack, you have to think of the Aconite family. They're all the brothers and sisters in that Aconite family. Ranunculus bulbosus, Ranunculus scleratus, especially when the tongue is affected. Extremely heavy mapped tongue like nitric acid, but something has happened. So you see, in a way, you can say that they cannot stomach it. So when you remember that their nerves cannot stomach this thing that happens, you will think of all these, this aconite, adonis, pulsatilla, when just weeping, no cause, ear pain, maybe little migraine, sick headaches, kind of thing. Pulsatilla, ranunculus scleratus, when the tongue is affected, they cannot swallow anything. You are thinking nitric acid, but it's much more acute presentation. Ranunculus scleratus, ranunculus bulbosus, when this herpes comes, older people, younger people, something has happened, audit season, keep ranunculus bulbosus in mind. Some tax notice, keep ranunculus bulbosus in mind. Urinary complaints, tax notice, keep Staph aureus in mind. Some heavy sty he has come with. Daughter's wedding got postponed, something happened, heart attack like symptoms, got a shock. First aconite, give aconite, maybe you will even give 1 m repeatedly, I would say. Then when he settles down, then ask what will happen if the daughter's wedding gets postponed, what happens. Cannot express, this, cannot even swallow that, cannot bear it, cannot swallow, the honor is affected, Staph aureus. But heart like symptoms, daughter's wedding got postponed, some event happened, what will people say. So this situational materia medica is something very important, you have to keep in mind. All right, so his daughter says later on that he never weeps. He comes back from work, we know that he's had a tough day at work, this man, the one who the audit was going on. But he has held everything back all these years. So you see, the system is under a stress. It cannot contain anymore. Why it cannot contain? Because it is subclass 1. Although the ego is slowly developing, the uh, identity is so fragile that it cannot contain this nervous thing, that this impression that comes from outside. Because of that, now over years, if he has held it back, now no longer he can. This is possibly the last straw. So, again, did very well on Ranunculus bulbosus. Very good friend of the homeopath who wants to show that homeopathy is quick. Aconite, Ranunculus bulbosus, arnica, to show that homeopathy is quick, fast, effective, can stop disease in the tract. You have to discuss that this is the pathology that I'm expecting. I'm expecting it may go to the lung. Please keep in mind. Please keep follow up. I will send these remedies, but it should take care. So that it gives a lot of confidence also to me. Now I know that if herpes comes, unless atypical presentations are there, I would ask if there is anything that happened at office, anything that happened at home. Give ranunculus bulbosus, take care of the pain, and then ask maybe for the secondary prescription. All right. Going forward. Okay, so I think I've already explained why ranunculaceae is subclass 1 related to pulsatilla. Meticulousness. This meticulousness and being proper, rule following. This is something, see, this is soft things that are not told to us. But in both the cases, or in all the 3 cases, that even when the daughter's wedding was suddenly, postponed or stopped, something happened. Uh, the propriety, how to be, they are not able to take it. Even this old man, the first one, who could not even swallow, he was telling his daughter that I will not send a pic today because I have not shaved. It is all over here. How will he shave? But I need to be properly dressed, properly shaved before I meet the doctor. This kind of thing is, the ranunculaceae is very important, and is needing to be ideal. So they put a lot of pressure on themselves also. They put a lot of pressure on others also. They're not able to bear their own impropriety. They're not able to bear others' impropriety also, and it affects them. So this is very important. So this is something to keep in mind. The patient says, "Oh, I didn't even have a shave before I came to see you," and you know that he cannot. So just, it adds that added layers of flavor to your prescription. You understand that, okay, this is what he means when he says. So it gives a one more confirmatory that Ranunculus bulbosus, Ranunculaceae family is very good. Okay. So again, mazak masti they don't like. Because they're very proper. No, impropriety they don't like. So in the office, suddenly somebody jokes about something. Just mind jesting aversion to ailments from some arguments that happen, because they are very tough on themselves. They're self-critical. So, like I said, this energy inside, they cannot contain it. So it creates a turmoil inside. They cannot even vocalize it. And this constant fear of losing control is there in all. Ranunculus bulbosus, Aconite, Staphylos aureus as a ranunculaceae, it is there. So remember. And when you will see more trembling, like I said, abdominal or urinary complaints, the sty which came up suddenly, then you will think of Staphylos aureus. But otherwise, Ranunculus bulbosus is your new friend. Please make friends with it. Please keep it in the clinic. And okay. I like these little cases very much, the little ones. He's almost, there's one more case, again, very recent during this time. So, again, pain, and he's a very interesting boy. I see him often. They stay very close by. So in the mornings, he's walking with his grandfather, with his mother. I've seen him when he was 4 days old. I prescribed for him. So from when he was 4 days old, I've been seeing him. Now he's 18 months old. Extremely curious, very intelligent. But he's not yet talking fully. So a lot of babbling is happening, a lot of lisp and babbling, long sentences, pointing out things. Only his mother understands what's happening, and all of that is there. So one evening, now his Mother calls and she says that he has been very difficult to manage of late. He has some he's doing some little few attention seeking things. Now his mother will say that, so I will keep it aside because I know how his mother's remedy also. And she's saying he's got a rash and it is everywhere. It began in the lower limbs, now buttocks, back of thigh, front of thigh, torso, underarms, arms, all over, and it is going up now into the this thing, raised eruptions and raised, red, swollen, itching. So again, sudden presentation. Call at 7:30 in the evening. That 1 hour ago we went to the friend's house. Little bit, some cat is there, some dog is there, something he was playing, and it came. But I know it's not cat related or dog related because they have 3, 4 cats at home. I also know that his mother is expecting again. So this dynamic is very important to understand. When the mother is expecting and it's a smaller child who's under 3, who's non-verbal, who cannot understand that what is going to happen, but obviously they say don't go close to the mother, don't fall on the belly. Then you have grandparents taking care. A lot of overcompensation is happening, that the child should not feel alone. But of course the child is, the innate intelligence is there, they know that something is happening. So he was not able to understand, he was not able to vocalize what is happening, but he knows that something is up. So he was asking for, like I said, so they were again very worried. What is this? Is it measles? Because this is the age. Is it chicken pox? Is this the age? So then you will ask, what are the chronology of symptoms? What happened? Was he having, already something? Is it measles season? Are there many cases? This is where community involvement we are at an advantage, because we know what are the, if there is a measles epidemic going on, then we know that what would be the symptoms that they could come with. There is chickenpox, then we know what are the symptoms that all our patients have come with. Chickenpox I'm not seeing very much in the clinic because they're suppressing it a lot, which is our loss, because if they get it once, then they get lifelong immunity. This is something that we have to keep educating our parents. But no, this was not none any of those. The presentation was very characteristic. Raised welts wherever he was itching. There was a lot of itching. It was red and swollen and big. And he was asking, he asked for a bath in the evening. And he was trying to find somewhere cool to sleep. This that he was trying to find. When they sent me the video, also he was asking for his blanket. And then he was so very interesting. The cat had not scratched him, but because the mother likes the cats and the mother is away from him, and because she's pregnant. He was pointing at the cat and said that the cat has scratched. But when you see the pictures, you know that it was not the cat. So I said, no, this is nothing to worry about. This is like urticaria. It happens. Some allergy is there. Then you have to now, reassure them what is happening. आर साल्ब से कैसा डिफरेंशिएशन करेंगे, क्योंकि रैननकुलस बल्बोसस वांट्स प्रॉपर शेविंग एंड ऑल. आर साल्ब में आपको एरप्शंस नहीं मिलेंगे ना. एरप्शंस कैसे रहेंगे? रैननकुलस बल्बोसस में हेर्पेस एरप्शन होता है, आर साल्ब में नहीं होता है. So propriety they also want, but there is fastidiousness. Here there is propriety. So doctor के पास मैं कैसे आ सकता हूँ, without shaving? So this is what your Staphylococcus or Ranunculus bulbosus will say. साफ सुथरा नहीं लग रहा है, गंदा लग रहा है, क्लीन नहीं लग रहा है, is what probably an R salve would say. But कहने पे नहीं, शेविंग पे नहीं, मैं कह रही हूँ कि प्रेजेंटेशन क्या है वो देखिए. If you have eruptions, it is herpes. That R salve has no sphere of action on your herpes. Probably ulcers, on the lower limbs in diabetics, in older people you have, but not in these kind of herpetic eruptions. It's a good question though. So you see, ऑडिट जब होता है, जब बात कुछ उठती है, पूछा जाता है कि ये फंड्स कहाँ गए, आपको धक्का पहुंचता है कि भला इसने ऐसे कैसे कर दिया. तो आप घर आते हो, खाना नहीं खा पाते हो, समथिंग इज हैपनिंग, व्हाट इज हैपनिंग यू डोंट नो, बात नहीं कर पा रहे हो. So that is much more a shock that has happened. You see, this is not our self presentation. So the whole story is important, not just this one thing. But it's a very good question. I like this question. So this boy, so what remedies you could think of? Urticaria, just sudden presentation. Okay, red, raised welts, itching all over, spread is quite fast, and was asking for lukewarm bath, and was asking for something cool to be put, like blanket he was taking. He was moving from one cool spot to the other on the bed. Yeah, so very this important. Apis, very good, very good. So apis again you have to keep in the, if you're making a kit for your patients, you should give them apis along with that. Apis works very fast. Something happens, actual bee sting happens also. Some allergic reaction happens and sudden swelling happens, angioedema, what they say. So apis is very important. So again, apis was given in water again because I wanted to repeat more often because the mother is extremely anxious. And first child, so first child, even if a scratch comes, then it is the huge emergency. Second child, she will see how it is. Even if the child falls and gets hurt, then they will not, कि ठीक है उठ जा जाके खेल. So it's like that. So this first child is a prince. So, and she's also pregnant. They're trying to overcompensate. I know I need to give very often because if the doctor is not appearing to give very often remedies, and you know that, when you're sending remedy, then sometimes you can give SL also, which I had given in this case. So I know that SL you can repeat very often. You tell them give every half an hour, two pills, three pills you give, and the child also likes to take it. Water dose is very easy. You take 3-4 pills. Okay, depends how long you're going to give. You have to be extremely sure of the remedy. So if you get 3-4 pills into a cup, crush it with the back of a spoon, put 100 ml water, dissolve it, cover it, and keep. Every time you stir it few times, so that little bit different from the previous time that you have given. Stir it and keep it in a safe place far away, in the kitchen somewhere covered, and stir it. Give, especially when people cannot swallow dry pills, and even opening the mouth is sometimes very painful. You will see. To give water dose is very easy. Just open the lip, just move the lower lip and put it between few drops, half a spoon teaspoonful between the, even with a pipette you can do for very small babies, older people, end stage management. You can give water doses with a pipette, 2-3 drops just inside the lower lip. It absorbs very fast. Underneath the tongue also sometimes you're not able to reach, so you can keep that, this thing it can be given maybe overnight. You want to give menstrual complaints, you can give where menstrual cramps are happening. You want to repeat very often, but you don't want to give one more one more, this is essentially one dose only, so you're kind of working around that one dose. So, and give lots of SL also. So you give 1 teaspoon of this, but give 5-6 pills of SL to put. The child is also very happy, mother is also very happy. Within 1 hour, and generally for this you have to say within 1 hour, call me. When I didn't get a call, after an hour I knew that that child had settled. um, Hardly 2-3 doses were given. Again, immediately I came to know that he was not in much pain, he was not irritated. He ate, he slept very well. So this sleep, very good sleep, asking for breakfast the next morning is a very important sign. And for little children, waking up, passing motion in the morning immediately, so then the mothers are very happy. Otherwise the constipation of one day, then they get really worked up. The child has not eaten, child will waste, and khana nahi khaya, malnutrition ho jayega. So if they pass motion and if they have had half a banana next morning, you know that your battle is 80% done. So only that evening, I think a little bit he was saying itching, and then it was given. Next morning or something, or 2 mornings later, I saw him. He said, as soon as he saw me, he says, "No, now that I'm seeing you, it's itching here again. You see, you give me the sweet pills." So and then he started talking and nice things, and so APIS, why it's important. Um, the next morning when I met him, 2 mornings later, he was talking to me like an equal, as if small 18-year-old put his hands behind. He was walking with me, he was pointing things, and he said, his mother said, this is the doctor who sent your medicine. Then immediately he showed his eye here, nothing was there, clean skin was there. He said, it's itching here, I want more sweet pills. And so his mother's remedy is the aramacao. The parrot. So for her, speech is very important. This, and now she's of course she's and she's very anxious. She talks a lot, and so you'll get maybe after 10 minutes you'll get maybe one symptom of some use from her. So I know that I need to rely on the child, the presentation, how the skin is looking. So then I have them send photographs, if it is on the thighs or on the back or on the groin area, that send photographs. So then it's also good for us when we have to tell them, you see, yesterday this was like this, and now today you see it is like this. I like this, somebody's asking me to prescribe for their patient. Let me finish my cases. You remedy for corn and palm, very interesting, very cheeky. Try out certain remedies, you'll come to know. Speak to the child, find out. So how I will solve your cases. Very nice. I like that. Okay. So mother's remedies are a macaw. So she wants the child to talk, you see. But now, if he starts talking, he also understands that she will probably not pay that much attention to him as she is. So this kind of energy dynamics between the mother and the child, this apis is known for its jealousy, you see. But non-verbal child, how he will express that something is going to happen. Mother is not as attached to me as before, and I'm not able to express it. So urticaria, itching, I'm irritated inside, so I'm irritating my skin. Something has happened. So the body also brings up the symptoms so nicely. If it is inside, he cannot express it. He will not be able to say, they will not be able to give attention. So both the sets of grandparents came. Everybody dropped everything. कि इसको rash हो गया, and they're all sitting. So he got his attention. He's obviously jealous he was not getting. So as a sidebar, as a little bit observation, I'm telling you that apis can be needed. Lycopodium is another remedy where sibling rivalry can be there. Then pulsatilla is another remedy where intense sibling rivalry can be there. You have to keep in mind. But in this boy is very intelligent. He's very restless, going about, very curious. And pulsatilla will weep, want to be picked up, want to be bought cake, something new, and will get pacified. This boy was not getting pacified. Lycopodium also will be very what is the word, ugly in their jealousy. So again, you have to see lycopodium, perhaps maybe stomach complaints, doesn't eat, gas is there, evening aggravation, wasting, actually not eating well but emaciating. So that kind of presentation, what is the whole presentation that you have to see. Then ignatia also, yeah, ignatia, pulsatilla, but mainly all these remedies, lycopodium, lacasis, will do all the spider remedies for sibling rivalry. Will do something naughty to get attention. Insect remedies also, apis especially, something naughty to get attention, because his underlying sibling rivalry is there. So it's very important to understand that life space. What are the other dynamics? Because it's not an isolated thing that this is happening. You see, there is his energy is reacting with other energies around him. He's picking up inputs, he's picking up information. But he's not able to understand how to do it, what it is exactly. But at the age that he is, his system is intelligent enough to throw out the symptoms, so that that at least for the time being, that sibling rivalry for is taken care of. But again, important to keep in mind that last time this was needed. All right, moving on. Again, sudden chest pains. Now, this is a young man in his 30s who comes to Mumbai every day on work. So he travels from Pune to Mumbai. So you can understand from his he's very well connected. He's trying to connect with you on LinkedIn. He's trying to connect. He's trying to meet people. He's trying to do a lot in a very short time. He's very ambitious. He's taking care of family. Although his father is there, he's the head of the family since few years. He's taken on that position. He makes all the decisions for them. He's earning for them. And small things like which scooter to buy or which fridge to buy, which car to buy. He's the one who's making the decisions. So sudden chest pains he started developing every time he has to travel to Mumbai for work. He does an up down every day. So he comes halfway by car, then he takes the local, then he goes again by local, takes the car, drives back. So a lot of hard work is also getting done, not just empty ambition. I will do big things and like Ruby AC family, and that I'll do big things, or maybe like China, but not doing anything about it. He was actually doing. He was networking at a very hectic, furious pace. So everything was checked out. Again, there was no cardiac, nothing was there, but chest uneasiness, what they talk about. He said acidity sort of symptoms came on suddenly. Somebody who's known to him had a heart complaint, neighbor fell ill, chest complaints similar. Also, some throat complaints was there. Every time he has to travel, he thinks what will happen if something happens, what will happen if something happens, and anxiety comes up. And it was not as acute as the uh, first two, 3 cases that I presented, but yet. So then I said heart complaints every time he travels. What it could be. It comes up as an acute chest complaint. Okay, so not calcarea sulf and all, because not very thin guy, very ambitious. Calcarea will not be a risk taker. Okay, Calcarea is, although it's a good suggestion, you have to see whether he will be a risk taker. This man is a risk taker. So Calcarea is not a risk taker. You don't understand. Nux vomica is a good suggestion. But I would expect that if there were loose motions or acidity, loose motion, liver complaints, something like that, ulcer, if there was, then I would have thought of Nux vomica. Good suggestion. Kali Ars, yeah. But you see, Kali Ars again, extremely anxious, which he was, but not a risk taker. Kali and Ars, both together, you put the two anxious remedies together, Kali cannot do anything without the family. So he was doing for the family. He had taken up a leadership position in the family. Okay. So he was a big risk taker. Kali Ars will not take a risk. So lycopodium again, ambitious, risk taker, cardiac anxiety. Yeah, it's a good suggestion. Lycopodium is a good suggestion, but will it present with chest complaints? I don't know whether lycopodium will present with chest complaints. It might present with some sort of ulcerative colitis, or it might present with some sort of anticipatory anxiety, like जलसेमियम, दैट ओके 3 दिन में बॉम्बे जाना है या परसों बॉम्बे जाना है, जैसे आज खत्म हो रहा है, जैसे परसों आ रहा है, जैसे दैट मॉर्निंग ही गेट्स वर्स एंड वर्स एंड वर्स, देन ही गेट्स अ डायरिया, देन आई वुड थिंक ऑफ जलसेमियम वुड बी very good. And then after that he gets very weak and very dull, and then I would think of a gelsemium. Carbo veg, why carbo veg? He's traveling, he's active, cardiac anxiety is there. I would not think. Iberis amara, I don't know whether Iberis I would think of in a thing like this. So first remedy, of course, my favorite, I gave Aconite. I thought maybe something has happened. Chest complaints are there, cardiac anxiety is there, ECG is normal. He said that somebody he heard was traveling and had an accident. So first remedy I gave us not cocculus. Cocculus will collapse. He was still working. He was still traveling. He didn't have late nights. So cocculus menispermacy, I would think whether when he was caring for the family, he was doing a lot of late nights. He was not sleeping. He would just have a lot of. If the patient had, vertigo, cannot even stand up, collapsing, then I would think of cocculus. Aconite was the first prescription that was given. So for his anxiety, at least little bit better, but I knew that it was not matching everything. So I said, I need to understand the life space. Why this person who's in his 30s is so ambitious and has taken on leadership role in his family. Why? So to go and understand what was why Aconite didn't work was perhaps it was too primitive for subclass 1. Perhaps I needed to look at something a little bit further along, which has cardiac symptoms. So could it be 3 caryophyllalis? But no, he didn't have any actual cardiac symptoms. So you see, I would have thought of the Cactaceae family if he was doing for his family, and if he was having actual cardiac symptoms, some sort of murmur, some sort of extra, sounds, moving out of the house, traveling, hectic pace, tuberculomasm perhaps. I would have thought of Cactaceae family. But here, ECG was normal. He didn't have, but this anxiety was definitely there while traveling. So I was looking at something a little further along, not third. I said, maybe need to look at fifth subclass. Okay. So, chest, he said some sort of spasm is there, sudden pain is there. Throat also, then he said, now I realize that throat also some sort of spasm is there, air doesn't go in. Says it is very important that I do the right thing for my family. This other man died suddenly. So, who's going to take the decisions for his family? Who's going to manage his family? I have to manage for I have to create that, for the resources for my family. I have to take the right decisions. Even if has to be a car that has to be bought, if the travel has to be done, I've taken on the responsibility. I have to do the right things. And then some sort of throat, I can't swallow. Is it phlegm? No, it's not phlegm. It's like cannot swallow, some sort of thing happens here, he said. But with this kind of thing, but with kind of an acute presentation like cardiac anxiety, there is a very interesting remedy that also, although no gastric symptoms were there, he was not eating well, he was also losing weight. So tuberculum perhaps, but there was no family history of tuberculosis. This was something sudden that had happened. He didn't have any hectic fevers along with that. So I thought of, and tuberculum will not cover the cardiac symptoms which was there, which was definitely there was an anxiety in the chest kind of thing. So going to the chat, seeing what everyone is saying. Causticum, magnesium lacasis, Oromet. Oromet would have, you see, in Oromet, what would happen? They would take on the responsibility for the entire family. They would have actual cardiac symptoms, and they would not let anyone know. In spite of having actual cardiac symptoms, they would still be traveling and doing very well. And later on, perhaps, once the heart attack had happened, you would come to know that the family would come to know that actually he had a heart, maybe like a blockage, and maybe like a minor heart attack, but he was still working. This would be the presentation of Oromet. And this so much anxiety would not be there. He had extreme anxiety. Why Dalkamara, Kali Brome, Kali Carb? They are not risk takers. You see, causticum, Kali Carb, Kali Brome, they're not risk takers. They're extremely fearful of what will happen, and anxiety for the future. So our salve is also good suggestion, but our salve will not have this kind of blockage sort of thing which was happening. Is air actually going in? I don't know, some sort of blockage is there, something is happening in the heart, some sort of thing. Will it suddenly stop? This kind of cardiac anxiety, but no cardiac actual changes are there. Nitric acid, no, 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 one second. So I went ahead and I was looking at, uh, see, this right and wrong came up very strongly. Okay. He has a sister who's not in a very good position. She's married, doesn't have children, so he's supporting her. He's making sure that she has her resources. Doing the right thing for her was very important for him. Then who will take care? Ambitious. This ambitious was also uh, not very overtly said, but it was very important. He was doing all this because he wanted to be, by 40, he wanted to be someone. So I came to right thing, doing the right thing, cardiac symptoms. So I came to, from our understanding, I came to the school age, yes. But something, this acute presentation which was there was something which was not like school age at all for me. pressure in the chest, no cardiac things, but he was in the doing also. He was not in subclass 1, which is feminine. He was in the world, he was doing in the doing, so he was in the masculine. I came to subclass 5. Okay, I came to a remedy group called as Rosales. Okay, this is again now this remedy group you have to also understand. Last time I showed you the plant chart. Unfortunately, I think this time I have not put the plant chart here. So maybe my friend Mansoor Mirza can put it up in the chat. The plant chart can be put up. And this Rosales family is very important. You see, it's in the womb stage of subclass 5, where the right and wrong is the most important thing. But this such a strong right and wrong comes in that because the consciousness of the other starts developing in this. You're taking responsibilities, you're in the world, you're doing for the family. Very important to do the right thing for the family, getting so exhausted with that. So some sort of acid remedy also, I knew it has to be there because he was emaciating also, phosphoric acid, picric acid, that sort of thing. But phosphoric acid and picric acid would have some sort of nervous symptoms, brain fog kind of thing. He didn't have that. He was working at full mental capacity. Phosphoric acid, none of the cravings, none of the other symptoms, no stomach symptoms, except that could not eat because some sort of block. What he was saying, cardiac anxiety will not, I will not expect in phosphoric acid. So he had started having dreams of some sort of war-like situation is there, and some sort of anxiety. This anxiety, which is underlying, especially heart-related anxiety, because somebody he came to know had some heart symptom at a very young age. Is also starting from a lot of noises and palpitations were happening. So also one more thing that was happening was when he was driving, which is the reason that he was leaving the car because he was not able to drive within Bombay. He was leaving the car somewhere outside Mumbai and then taking the train. Now, although the train he was not driving, but in the crowd in the train also, these symptoms were getting worse. So some sort of, as I could understand, some sort of air hunger sort of thing was also there, acid sort of thing was there. Then I was scanning the fifth subclass. I came to a very interesting remedy. So I came to hydrocyanic acid. You see, hydrocyanic acid is acute miasm in the Rosales, in the Rose family. Excessive worry for the family members, a lot of panic and dread. So, main sphere of action when I checked, because I normally check the sphere of action, heart and breathing, kidney problems. So, and it's mainly centered as a sort of acute distillation of the heart symptoms, acute panic, and acute cardiac symptoms, whereas there is no cardiac pathology, some sort of block. Or so you can, where clinically they're using it along with laurocerasis, which is very important remedy, same family, which is why studying them from the family point of view gives you 2 3 family members to understand and differentiate. This was hydrocyanic acid that I gave in 200 potency. I said to repeat it weekly once because he was traveling still, he was working still. First symptom that improved was this, some block in the throat became better. Cardiac symptoms reduced in intensity. Anxiety is reduced in intensity. He started eating better. But this responsibility for the family, ambitiousness, getting affected when something happened to someone else, this panic and dread is something underlying which is still there, which will need probably a lot more work to be done on. And also some sort of uh, why not fifth subclass adult stage? Why not adult stage? Because he didn't have the resources to manage. And also when I was checking fifth subclass adult stage, this kind of, see, this kind of spasm here and this kind of cardiac anxiety and this kind of when you say this kind of little restlessness, um, and this kind of vague dread and panic, where you know that as you go to the adults, and they are able to vocalize. They are more they have more resources at their disposal to deal with their things. So for me it was much more, was unable to manage. Yeah, precisely, he was unable to manage the situation as an adult. I saw a lot of vague anxieties and dread. This When I went to the Materia Medica, I was pleasantly surprised to see fear of crossing the road, fear of oncoming traffic, then this dreams of dread. So when I went, and then I read Yakir's book, was checking. Hydrocyanic acid is this Zyklon B, which was mainly used as an agent in the mass extermination of Jews, Rosaceae family, but as a chemical compound when it was used. We know that the rose family, all of them have, the seeds have this cyano group in them. We have seen in a lot of movies where cherry pits are used, almond pits are used to distill, remove the hydrocyanic acid, and then give. So the hydrocyanic acid, mainly what it does is it affects the mitochondria of the cell, as I understood. It affects the powerhouse, the mitochondria of the cell, and that is why the action of the rapidity of action is so much, and that is why the anxiety is so much, and extreme anxiety that what will happen to my people. So this what will happen to my people is probably something that has been grafted onto the remedy, I would say, from the way that it was used. It was used in the mass extermination of Jews, so the survivors, what will happen to them, what will happen to my people. So as a collective consciousness, I think this symptom has become engrafted onto the hydrocyanic acid itself. But going forward, like when this person is still on treatment, and going forward, I would probably look at Lorocerassus, which is from the same family, which is very sensitive to criticism, as something may be slightly better prescription, but for him the cardiac anxiety is very important. So the cardiac symptoms definitely improve. He's doing much better. Yeah, cellular oxidation is destroyed. Correct, Dr. Mansoor. So this Rosales family also. So in the other Rosales family, in him also there were no love themes. So you see this heartbreak, falling in love, uh, which is Rosa Californica, Rosa Damascena. They're softer. This He was a harder that way, much more individual, not very soft and romantic, and that aspect which is normally there in Rosa Californica, Rosa Damascena was not there in him. Lorocerassus is something that I'm keeping in the back of my mind. Then when I went to Boger, when I was checking clinically, they said that breathing problems of newborn are mainly there in hydrocyanic acid. When you look at Lorocerassus, it has cardiac symptoms also, and it has kidney problems of newborn also. So Lorocerassus is again remedy. Laurie Dack has presented a lot of cases with Lorocerassus. Very important to keep in mind. Just give me a couple, 1 minute. Yeah. Lorocerassus, again, I would keep in mind for this. All right. Rosales, again, family. Since this time we are doing the pain management, I'm not going into the family and the study of that. And which we'll probably do another time, but it's important to keep in mind. So from there, I got the other family member, Lorocerassus, to keep in mind as probably something he would need constitutionally. So I would still look there. All right. So moving along. All right. So again, another acute case that came up about 3 weeks ago. Again, an old woman. See, these old people symptoms, you need to, because when they come as an acute, there often is no time because they're in a lot of pain. The vitality is low. There is often no time to take a detailed case and say that I will do this and I'll give you the constitutional prescription. They want symptomatic relief because every small thing bothers them, and already their mobility is curtailed. Most of them are at home, so these vein symptoms and all can come. So existing varicose veins, sudden engorgement in 2-3 areas, redness has come now. So previously engorgement, excuse me, previously engorgement was there, but this redness, heat, and this cannot touch that portion. They sent me photographs again, and I could clearly see that the vein is tortuous in the left lower limb on the calf muscle. So this is of many many years, but suddenly now why is there an acute on that? And this acute on this would have to be taken care of immediately, because you know that in older people who have cardiac symptoms, this can be life threatening also. If this phlebitis happens, and or if if clot happens, goes to the heart. Luckily she didn't have any cardiac symptoms otherwise, so I was okay. So if she had had a cardiac symptom, then I would have thought of probably another set of remedies. But because she didn't have any cardiac symptom, this was an acute presentation, this is the easy remedy which was given to her. Can anybody guess? I'm trying to reach the red hot, cannot be touched, acute on chronic. Why can't I see the chat? uh, what remedy could probably come? Yeah, belladonna, very easy. So immediately belladonna 30. So in belladonna, normally what I do, I don't give very high. I give a single dose of belladonna 30. Dr. Balwinder, who's the senior in our group, is very there are certain things that he has seen repeatedly over the last 40 years of 35 plus 40 years of his practice. Belladonna generally he gives in 30, he gives a single dose and he waits. If there is going to be a change, it's going to be with that belladonna 30. If there is no change in a couple of hours, then you know that that remedy has not worked. But at least whatever is the acuity of that situation, it has been handled with belladonna. So this is something that when he shares cases with us, when he talks, when we are in touch, because every time we get cases, they are discussed with him. We tell him the prescription and he okays it. And oftentimes there is no time to ask him before we prescribe. So, no, the recording, Deepu will have to see whether the recording will be made available. So, belladonna was immediately given. Immediately, within a couple of hours, the redness reduced. So, you know that whatever is the acute focus in that vein, already varicose vein, has been taken care of. You know that because luckily that there are no cardiac symptoms, so you need not worry. You know that because it is red hot and cannot be touched, that belladonna will work. If it is not red hot and cannot be touched, then you know that you have to go for another set of remedies. What is that other set of remedies? Can anybody tell me? Where it is not red hot, where it is not red hot, but it is cannot hang the feet down, and there is issue in the varicose veins. Can somebody tell me what could be the remedies? All right. Yeah. Yes. Vipera, pulsatilla, amamelis. Very good. Yeah. So Vipera would be probably the in an older person, circulatory issues. Bothrops also is something that I would think of, not floric acid. Um, Floric acid will not have this acute kind of presentation, not sulfur also. You see, in an older person with varicose veins, where there is an acute presentation, Arnica, not really. I have not really seen, but I would think of if there is, yeah, Bellisper is very interesting remedy as well. Yeah, Calcarea floor again, I would not think, because see, when you have varicose veins, the tortuosity of the veins are already there, and you know that it comes with an acute presentation where some sort of focus has happened, some sort of clot is being formed there, or something, inflammation has happened, rubokeloid tumor cannot touch. You know that if there is a cardiac condition, that you need to probably look at the reptile group of remedies, because there is a uh, rapidity of action, right? Because the most of these venoms are vasculotoxic, cardiotoxic, not lacasis. I would go with bothrops, lanceolitis, or I would go with bitis, not bitis also, bothrops, and I would go with vipera. So these are the two main, because we need to look at something which directly affects the veins and is like a hemolytic. Okay, so we need to look at that. But in this case, because there were no underlying cardiac symptoms, because it was red hot to touch, I know that there is an inflammatory focus there, which is acute on chronic. Then I looked at Belladonna. Belladonna definitely helped. Then I need to know that once Belladonna, the phase is over and the redness has gone and the tenderness has gone, that I need to look at something much more constitutional, which would be for her. Am I expecting completely that these tortuous varicose veins will get better and she will look like a 40-year-old in for a 70-year-old woman? No. I know that these limitations are there. But when the presentation is there, what will happen in that? I know that definitely we need to keep these things in mind, take care of them. So, all right. So what I said, of course, Belladonna 30 gave immediate relief, keeping it raised. She and cold compress. So cold compress was something that really helped her. Then detailed case taking was taken, and then constitutional remedy was found, which we can discuss another time when we're discussing. So we are now doing acute presentations. Uh, what is the? All right, I will look at the chat later. Huh. Going forward, this was also very interesting. This was also done on the phone. This was a phone consultation in another country actually. So this is a woman in her 80s. There was a sudden deterioration of health. Sudden deterioration of health is very important to keep in mind. So now you know that vitality is very low. She was extremely bedridden. She had loss of bowel and bladder control. They had to take her to the hospital. When they checked, of course, all the tests were done. When they checked, they saw that there was an advanced malignancy. And you know that in this case, we need to do pain relief. We are not going to be doing. So you see, we are not going to be doing. Please suggest remedy for varicose ulcers. Very interesting. Yeah. So cecal cornutum is something that we have seen. So Dr. Balwinder and I, we are managing a patient who has extensive varicose ulcers. So she's helped with weekly doses of cecal core because each size of the ulcer is so big in the lower extremities. Burning pain is there. So cecal core is helping her. She had gone for Dr. Divya. I'm answering yours. This is not the case that I'm discussing. So she had gone for several skin grafts, and each time the skin graft had not taken. So this time, before going for the skin graft, because we know that multiple ulcers this size in the lower limbs, we know that where the non-healing ulcers of chronic duration, many years duration. We know that with the homeopathic medicine, I'm not going to get a granulation and I'm not going to see the skin forming because there are multiple ulcers, multiple times the graft has been tried. So cecal core was one of the remedies that when I took the case, then I sent the photos and Dr. Balwinder suggested. So he and I were managing. He's extremely clinically sound. So with that, with weekly doses, 200 cecal core, this lady went for a skin graft recently. And for the first time, the skin graft has taken. So even the doctors were surprised that this time what is different because she has an underlying autoimmune condition also. She has an endarteritis. I think she has a polyarteritis nodosa. So sepia is one of the remedies that the constitutionally comes up. But in the acute now we need to take care because she's doing everyday dressing by herself. She cannot go out in this COVID situation. Last 5 months, 5 6 months we are managing her. She's on cecal core weekly, once 200. Now she gets a dry dose. With that she could travel, she could go to another city, she could get a skin graft, and for the first time the skin grafts have taken. So now we are hoping that with maybe once in a while maintenance dose of cecal core, we would be able to give her constitutional, which is sepia, which will now take care of as a support, which will take care of her constitution, her mental state, and help also with the ulcers healing. But cecal core is a main remedy, I would think, for varicose ulcers. So in this case, this was the lady. Coming back to case number 7. Very good questions I'm getting today. I'm very happy. So case number 7. So again, this was done by email from another country. Language issue was there. They don't speak English. I don't speak German. So she had sudden what took them to the doctor was this loss of bowel and bladder control, which was sudden. When they went, they saw that she was in advanced malignancy, and she just kept saying, "I want to die, I want to die, I want to die." And they had to catheterize her and keep her there, and she was in a lot of pain. So now we know that underlying syphilitic pathology is going on. We know that the bowel and bladder control is not something that homeopathic medicine is going to do immediately, but just this desire to die. Okay, so she kept saying, "I want to die, I want to die, I want to die, I want to die." So we just took this acute situation which was there. They wanted to somehow 80 plus advanced malignancy. We know that she's not going to get completely rejuvenated and completely cancer malignancy free and bounce back from this, because vitality was very low. So one of the things that her daughter was saying was that she's been very difficult to take care of even before this malignancy. And she would feign a lot of symptoms, show them as more serious than they are. She get frequent eruptions, very painful frequent eruptions, burning pains. So then, once the catheterization was done, the family brought her back home. So the hospital said that they would not be able to do anything for her, and this kind of situation will come to you. What would you do in this kind of situation? What would you give? 80 plus woman sudden, and they discovered in this situation in COVID background, advanced malignancy, very difficult to take care of, extremely difficult. There are some old people who are very easy to take care of, and there are some really they drain the energy of families around them. So she would pretend to have a lot of symptoms. She would really trouble them. So, and because she was saying that she would die, she would die, she would die. No, because Aurum Met would not trouble you, see. Aurum Met at this age, MAGFOS, advanced malignancy, how we will give? It will not match the depth of the pathology. No? Aurum Met, yeah, Tarantula is very interesting. This is what I gave her because she used to be very difficult to take care of. She used to pretend to have symptoms even before. So Tarantula cubensis has this the end stages. So now you see, as homeopaths, when you are in managing families, our relationship with them becomes one of somebody who is almost like an honorary member of some families. We are aware of the family dynamics. What happens, how is she, does it she take, she the head of the family, does she take responsibility? Often daughter-in-law comes, mother-in-law comes, older people, you have second third generation older ones who are there. So Tarantula cubensis is a very interesting remedy because it matches the pathology also. It matches your syphilitic nature also of that. Advanced malignancy was there, which MACFOS and Oromet will cover cardiac conditions. You have some sort of things, but they will be easy to take care of. They will not be difficult to take care of. Aurum muriaticum natronatum, in fact, will be taking care of family even when they have cancer. They will not be aurum metallicum, aurum muriaticum natronatum, worried about the business, worried about the family, worried about the mother, um, extremely closed. Um, Tarantula cubensis was given. And although she was, in advanced malignancy, because of this sudden loss of bowel and bladder control, because I had nothing to lose really, I told them to give her weekly once dose. So we come to what, 6 and 7. All right. Okay. Take it. So, this case, Tarantula cubensis was given weekly once, and the patient came back home. But Tarantula cubensis, surprisingly, what happened was this I want to die, this talk stopped. Bladder control came became better. Bowel control became better. So you see, I have seen this particular thing, this sudden loss of bowel control in older people to get attention. Um, I've seen in several, two or three cases, not several, three cases I've given. You have 80-year-old, 88-year-old, 90-year-old, at home. Usually you have the attendant. They have a very devoted attendant. What they do, they will say that I need to pass motion. Okay, then the attendant will help them undress and everything because they are bedridden, right? And then they will not pass motion. Then, just when the attendant dresses them up and puts them back in bed, they will purposely pass motion. Um, it is unbelievable. Then, or what the sterantilocubensis will do, it's very characteristic. Several in the same story and a variation of that repeats. Another patient, 85-year-old, very sharp, no other illnesses, but bedridden. So one floor of the house was for her, the other floor, the other family members were living. The day that the son, who's also a doctor, doesn't come to meet her, that day what she would do, she would say that I need to pass motion. The attendant would help her undress and give her the bedpan. She would not pass. When she would dress her up, she would purposely soil the bedclothes, pass motion, and she would smear it everywhere and keep. Okay. So when the son comes to see, what will happen? She'll say, she's not taking care of me. You see, I told her several times, she's not taking care. So this is an extension of this rubric feigning. So this tarantula cubensis, I've seen several times, that this sort of thing that they do, they are extremely difficult to take care of, because this impulsiveness is also there. Empty mind is a devil's workshop. They're sharp, impulsive. They want some sort of attention, some sort of um, theatrics. So then they do these things. So even in this patient, bowel was not really a bowel loss. She was feigning that. Tarentilocubensis, they could remove the catheter. She was, she got bowel control. She stopped crying that she was going to die right now, and she had a very peaceful end in her sleep. So maybe by the fourth week after she came back home, after 4 doses, I think she had a in advanced malignancy. The entire family was at peace. She went peacefully in her sleep without any theatrics. Tarantula cubensis helps. So this the previous case where this tortuous varicose veins were there was one of the other remedies where in old people with this low circulation, and cerebral circulation is a little poor, and they get this little vertigo, and this kind of theatrics that they do a little bit. Tarantula is a good remedy. Theridion is a good remedy to remember. Theridion. Both are spider remedies, so you can understand from just the background of how easy or how difficult they are to take care of as older people. So very important group of remedies, I would say, because of the impulsiveness, the hysteria, kind of little melodrama, little theatrics, sudden symptoms coming and going. You'll see high BP also, low BP also, and kind of like you want to tell the patient, make up your mind. Do you want high BP or you want low BP? So don't do this. So this kind of thing, this kind of picture, changeability, but with this kind of underlying need that getting attention from the doctor or from the family members. Spider group of remedies is very important. Also end stage management, pain management, because this lady, I cannot tell you how happy a family is when somebody who's is so difficult to take care of, your entire energy is stuck in them. And so because spiders as remedies also, the spider, what does it do? It it injects the venom, it keeps them in suspended animation, so then they don't die, they don't live. So whenever the spider is ready, it goes and it eats, right? So if you translate that that kind of pathology, the toxicness into human relationships. So you see that entire energy of the family is stuck. They're not able to move or go to work. They're not able to be with her, and when they're with her, that all that energy is being sucked out of them. That taking care of her is very tough, extremely difficult, not easy people to take care of. And there is a sense of relief when, from the entire family gives a sigh of relief when this older woman, when she came back home, and she passed away in her sleep, sadly. But homeopathy is, you have a whole family converting to homeopathy because you're able to manage that sort of person get a peaceful end. And so this energy drain. So, if there are people who do energy medicine here, they call them energy vampires. Somebody who cannot let you live, cannot let you die, keeps you stuck in a particular thing. The family dynamics changes because of them. So, homeopathy definitely it's very important to understand the life space. It's very important to understand where they come from, what they're doing, what is the pathology, what is the age, what is the underlying diseases, what happens. So again, these two remedies are life sent for the pain and suffering of dying. Tarantula cubensis, very important remedy. All right. So Theridion again, as I was saying, cardiac uneasiness. So this again, this you see in these families, what are these old people doing? I remember when I was in second or third year, gone to BHMS studying, gone to visit somebody. They had an older person, maybe 85, in their house. All she would do every day is just tear newspaper, fold it, and keep it under her mattress. Into long strips, fold it, keep it under her mattress. So, what is this as a rubric when you see it, when you go and you are seeing? If you don't have symptoms, if you have positive symptoms, you have to ask what are they doing in their day? How are they managing their time? So this fruitless activity. What is this tearing paper strips and keeping it? It's no. At the same time, you have restless hands, so it's something to do. So it's a fruitless activity. They don't sleep. Small noises aggravate them. Some sort of uneasiness constantly, and because of this circulatory disturbance, you have vertigo of old people. So again, this kind of OCD, first thing she would do as soon as the newspaper is received is take it, tear it, fold it, and put it under the mattress. So, again, you can see that Theridon is a very good remedy for that kind of OCD. So very important to remember in our old people. Why OCD is there, we know, because this desire for fruitless activity is there. So this is the entry point for why that these two remedies, Tarantula cubensis and Theridion, are very good for OCD. And the impulsiveness also. So when you get this trio, impulsiveness, restless hands, fruitless activity, then you get that is a very good three symptom entry point into understanding why what is this OCD. A very good remedy for OCD in old people also to keep in mind. So all right, so there are no questions, it seems, or observations. All right, going further. Yeah, so destructiveness is another thing, and also fruitless activity, restless hands, fruitless, restless, some sort of keeping the family busy, keeping them. In Theridion, I would again give, if I'm sure, if I see this kind of OCD, this kind of thing, I would give 200 or 1 m even. If the vitality is good, give 1 m weekly once. Why not? If you're not sure, vitality is a little bit low, then I would give 200. Again, I would give weekly once. I would keep the this thing with them. I would give a lot of SL also, because you will get a lot of these calls, sudden some uneasiness, some sort of thing is happening, some vague symptoms. So keep 2-3 bottles of SL also with them. Keep one for stomach, one for vertigo, one for this, but give weekly once Theridion for sure. Tarantula, the more destructive is Tarantula. This kind of harmless OCD, but still fruitless restlessness, Theridion, Theridion curacipicum, Dr. Shab. Orange, it's called orange spider, I think. Theridion. Um, so, because also, if you'll see in, what was I going to say? I was going to say something. Anyway, it escapes me in the moment. So, yeah, so older people, as I was saying, this OCD is something that families will come to you for. They will definitely come to you. And, destructive kind of OCD with impulsiveness and thing, you will give tarantula cubensis, feigning illnesses. This kind of harmless OCD, but OCD nevertheless a little irritating, in the environment, and fruitless busyness, you would give Theridion, where vertigo is the chief symptom. All right. Um, Next. Yeah. So, as I say, end stage management is something a lot of our patients pain. End stage management, as I said, when they come to know that you can do, when you speak to them, when they're seeing that you can handle the small symptoms, you might have a lot of malignancies where chemo cannot be given, where they've had 2 3 cycles of chemo and they're coming to you, and they're saying that age is also there. Last time she didn't take well to chemo. It has spread into the liver, it has spread into the pancreas, it has spread into the intestines, maybe stomach. Not eating. Can you do something? So we have far more superior remedies in homeopathy than in allopathy, because allopathy, what they can do if they don't do chemos, they put a morphine patch. So morphine, again, it's a 7-day patch that is put somewhere. It gives metered doses, and it's supposed to take care. It's very effective. But you see, with that, what will happen with morphine, which is given, is that there is only sleep. So, if this person is intending in the last stages of malignancy to set their affairs straight, to spend waiting for family member, to have a meaningful talk, maybe to give their instructions, or estate planning and things like that, where you need signatures and things like that. This is where, for the bank and a lot of things, this is where homeopathy really is tremendously superior. Because you see, for families where closure is needed, you need homeopathy. Yeah. So I would give these are some of the remedies. We know, because morphine is given as a patch, opium could also be indicated if there are constipations. Now, let's begin with, supposing there is liver, a CA. Then you would need a certain constellation of remedies which would be given. Uh, Organ support, definitely curcuma longa turmeric is to be given 30 once a day. This is long term, can be given over months, because you see, when the liver is breaking down and the bilirubin is getting released into the circulation, you have the yellowness. We are very worried that when they are waiting for family members to arrive, when bank things needs to be done, we are very worried that it should not affect cross the blood brain barrier, and make them where they are not, toxicity should not increase. Curcuma longa definitely arrests that. So I was very surprised, pleasantly surprised to see that curcumin, there is a lot of studies are being done. It's a hepatoprotective. They only know that it's a hepatoprotective. So we have the ability that, if you can give potentized curcuma longa 30 liver CAs, over months it can be given 31 dose once a day. I just want to, first of all, before I give this protocol, I want to give thanks to Dr. Balwinder. This is all from his clinical studies, and we have used this. We have used these remedies, and he's been instrumental in this, in preparing this list, actually. So, Curcuma has helped. Now, if there is, along with the liver symptoms, if there is bleeding, if you're seeing petechiae, if you're seeing that, some waking up from sleeping aggravation is there, maybe you're suspecting like a esophageal varices, or along with stomach CA, if you're suspecting some sort of course, liver CA, and, the bilirubin has started leaking, the person is looking yellow. Curcuma will take care of that, but also our snake group of remedies really help. Crotalus horridus can be given 30. So we are no longer now in the constitutional single remedy giving and waiting. We are more, we move on to the symptomatic relief on a daily basis, where you get symptoms in the morning from the patient's person who's taking care, and or the attendant, and how the night was, how the stool was, how the appetite was, how waking up from sleep was, what are the new symptoms of the day. You get that message, or you get that information, and then based on that, you give that remedy for the day. You've already given a kit. So we are speaking of this kind of situation, which is very important, and it keeps them completely mentally clear till the last minute. And we have seen this. Dr. Balwinder has assisted. He has not assisted. He has managed and taught uh, several of these situations, cases where with his under his tutelage, we have managed these cases. So supposing there is bloating after eating, you already know that in stomach CA there is pain after eating, but supposing the stomach CA has been removed immediately. When you're suspecting CA, first of all, the protocol is to start uranium nitricum 6x, okay, twice a day. Uranium nitricum is instrumental in has been instrumental in many cases in preventing the local and the distant secondaries when just before the diagnosis. Now, supposing right after that the CA is removed from the stomach, and then you have the stomach, the surgery which is done, you lose the surface area of the stomach. So um, pain is there, cannot eat, burning pains are there, pain, heaviness after eating small quantities, wasting. There, your arsenic amalgam really helps, and your curcuma longa also helps. And your when the supposing bleeding starts, supposing you have liver getting affected, crotalus horridus, uranium nitricum, ornithogalum, yes. Ornithogalum is when already the ulcers are chronic, and the what is the characteristic bottle, leather bottle something appearance of the stomach has already happened. Uranium nitricum 6x immediately, twice a day you have to begin. As soon as you hear that some symptoms are there, we are going for testing. We don't know if it is whether gastroscopy is going to be done. We don't know what is going to come out. Start uranium nitricum 6x. Nothing will happen. Twice a day you have to start. It will prevent the further secondaries from happening, local and distant. You can stop it later on. You can stop it. But uranium nitricum, Dr. Sujit Chatterjee has proved, and Dr. Balwinder uses it extensively. And ornithogalum is when, umbelatum is when I think CA is there, and probably you cannot do surgery to remove, that the big portion of the stomach is affected. So ornithogalum can be there, but RSALP can be given. And, when your liver is affected, curcuma longa, crotalus horridus, lycopodium. Lycopodium for this big evening. Uranium nitricum can be given for months on end. Stop, start, stop, start. Uranium nitricum, especially for stomach this thing affections. And curcuma longa, I cannot stress enough how much we need to use this remedy, much more. So I'm just going to shut chat for a second. I'll look at it later. So after eating, if there is this thing, gas is there, upper this thing, a lot of uneasiness happens, arsal. Lower abdomen gas is there, evening sort of thing, hunger is there but cannot eat, in this kind of thing, lycopodium. Then of course we have seen old age symptoms, tarantula, this thing we have seen. Okay, so this we have seen. Then most of these remedies in pill form, you can put inside the lower lip, and you can just allow it to dissolve. 6x uranium, of course, because it comes in slightly larger tabs, it'll have to be chewed. So you can powder it if necessary, if they are not able to chew it. So curcuma, as I said, I checked an anti-inflammatory, antimicrobial, anti-tumor, and hepatoprotective. So we're not using it enough. We have to use it much more. Um, all right. So lycopodium, as I said, end stage organ support is very important. See, liver is the main detoxifying organ of the body. If you're waiting, if you want to extend the last stage, chemo is not possible, pain management is going on, let pain management go on its own. Symptomatic relief only homeopathy can do. It's 100 times far superior than any allopathic medicine that can be given for pain. So, along with Lycopodium, Crotalus horridus, especially when you see lying down on the right side aggravates Crotalus horridus. Liver is actively breaking down because you see the venom, Crotalus horridus, is cytotoxic, hepatotoxic, it's breaking down. So, the bilirubin is getting released in vast quantities and will soon cross the blood brain barrier. So they're doing all the estate planning, signatures are required, hands should not be shaky. um, Crotalus horridus is extremely helpful. Suddenly in that, if symptom comes, air hunger comes, then carboveg can be given as 30. It can be given every 30 minutes, it can be given every 15 minutes. Carboveg definitely takes care of the air hunger, and helps. And then, the state that remains is again comes back to probably a Crotalus horridus or a Lycopodium or an arsal. And in the very end, you need either Aconite, or you need Carboveg at the very end. Aconite for the fear of impending death. Aconite is far, 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 far superior than any morphine patch can help. And Carboveg also. For the end, you're managing at home, little bit sort of bed sores have started, calendula is being applied there, but you know that uh, air is not enough, oxygen is being given. Carboveg is extremely important in that situation. So we need to look at our remedies differently. We can manage beginning, we can manage acutes, we can manage after childbirth, we can manage as soon as the child is born. Looking at the symptoms, we can manage during pregnancy, we can manage immediately after childbirth. We can manage when malignancy is detected. We can manage during chemo. You give your radium bromide. If radiation is happening and nausea is there, you can give your uranium nitricum. You can give your um, radium brom is a main remedy you can give immediately after radiation. You can give it, and you keep this kit with them, and you can help tremendously. And the important thing is to trust that our remedies work and to not be fearful, because we are not promising that we're going to make them better. We're promising that whatever um, symptoms come up, symptomatic relief is far rapid. So in such decreased vitality, with such massive end stage cancers also, the homeopathic medicine is so powerful that using whatever remaining vitality is there, it works so fast. So even 200, I know there's a Dr. Shri, in Pune, who is even using 1M in when he's extremely sure of the remedy, because he knows that for the rapidity of action, using whatever in brain tumor second stage in 48. I don't know what are the other symptoms, what are the Dr. Harpreet, what is the life situation. You need to look at all of that. Ruta graveolens is one of the important remedies I know for brain tumor. So but you'll have to check a lot of things and then you'll have to give. Unfortunately, I won't be able to solve other people's cases, so I need to present my own. So life situation definitely helps. Yeah. So yeah. So, and then another huge group of remedies, which I think would need probably another session to cover are all the subclass 6 Asteraceae group of remedies. Extremely important for pain relief of every kind, right from your Arnica, Artemisia vulgaris, your Bellis, your all the remedies in that are extremely important. Bellis, especially when there is a bruise and there is a in deep within the abdomen, there is some sort of injury and a tumor comes there. So Bellis perennis is the remedy. I've given Bellis perennis. It works very fast. Immediately it works. Increasing rigidity this boy had, all his joints, and they didn't know what it was, autoimmune, they didn't know what it was. All his joints from below started getting affected. They thought it was Lyme disease. They didn't know what it was. But he had this thing that even though he was in so much pain that he had to go and play football and score the most important goal for his team. So, and based on that, because Bellis is cancermism in the Asteraceae, I gave Bellis perennis. So Bellis perennis is very important remedy. Then you have your Eupatorium, your Erigeron, all of them are in Asteraceae. So it's very interesting that when injury comes from outside, which is the subclass 6 theme, your Asteralis are very extremely important. Calendula, Arnica are in this group. So yeah, Cardus marianus is also in this. Again, one more very important remedy for liver support, especially when gallbladder is affected, when there is damage. You need to give something more. You can. It is given as a tea also, I believe. Um, Cardus marianus in 30 can be given daily along with curcuma longa. So Chamomilla sina we know, Echinacea we know. Echinacea when hospital infections, some surgery they go for, they have picked up some infection there and they come with some sort of eruptions which with very foul discharge from the hospital. Echinacea is a blood purifier. So Echinacea, Erigeron for bleeding, Eupatorium for all kinds of pains. All these are in the Calendula family remedies. So they are all extremely important for pain management, end stage pain management also, your acutes also, your acute and chronics, especially for old people. Calendula is routinely given from our clinic as a tea for gargles during root canal. This is again something developed by Dr. Balvinder, and it's extremely useful. I cannot underscore how important it is. So these remedies need to be looked at from a new point of view. We need to reacquaint ourselves with all the brilliant stars that are there in our materia medica, which are underused because we don't know what are the spheres of action. But otherwise, they are waiting. They are soldiers. They are waiting. They are extremely useful, extremely effective, very quick. Yeah. So that was my going back to the last slide. So this was the last one that I think. Yeah. So this was the last one that I was looking at, and that is my presentation. So 1 second, just going to stop screen share.
Yes.
Yeah. So this was yeah. Yes. Compositive family plants also grow effortlessly like weeds. Yeah, precisely. Also, along with Dr. Shruti Shah, who has come, who's from Bhavnagar, who's done an extensive amount of work on breast cancer, generally uses the same philosophy that what works, what grows as a weed, has the active principle to spread like a weed, unwantedly in the human body. So she uses a lot of these weed plants in cancer. So end stage management, most of them are very important. So these are this is my this thing, and I think I've handled all the questions as they came along at the
There are
same.
some other questions in the YouTube as well, but there are
Yeah,
some questions, but it was it.
no problem. You can tell me.
But it's okay. No worries.
Yeah. All right.
So
This is
I think ma'am handled every session, and
yeah. Yes,
The
yes.
doubts are there. If you have any doubts, we can have quick session. Quick.
Yeah, yeah, sure. We can definitely do that, Deepu. You know that I'm available for all of you. And very nice to see my colleague Dr. Mansoor Mirza was also there. Dr. Mansoor, Dr. Balwinder, Dr. Meeta Nilani, Dr. Mansoor, um, and Dr. Vinita and myself. We are Team Vitalia. We are doing webinars every week. We are calling our colleagues from abroad. We had a huge series of lectures with Dr. Mikhail Yakir on the ancient plants, and we're doing webinars every week. Please reach out to us, any of
Yes,
us, if
yes.
you want to
And I
attend.
also put the YouTube channel link in the chat as well. I will post it again. No worries.
Yeah, yeah, sure.
Yeah.
Sure. So
So
thank you very much to everyone. Thank you, Deepu. Always, it's always interesting to interact with you and look forward to seeing you. Thank you very much to everyone for
and we
paying.
have a surprise coming up. We won't tell now. Yes, ma'am. In January, we have a surprise now from Vitalia. Someone special is coming
Yes,
for our
yes,
platform.
yes, yes. The announcements are coming. Please look at Vitalia webinars, VITALIAH webinars. This is our
Yes.
YouTube channel. There are some, videos which are put up there. We are conducting monthly sessions called as Vital with Vitalia. We're discussing the entire plant chart, uh, subclass by subclass. We have a lot of our colleagues who are giving freely of their time to come and present for that. And Dr. Mahesh Gandhi has recently joined us as chief mentor. So what began as a small online mental wellness clinic in April this year has grown, and we're very happy with our collaborations with Dr. Deepu also. Very young enthusiastic doctor in Dr. Deepu. We are very happy to have him. And Vital with Vitalia is once a month. It's an interactive study session that we do. It is through cases. We have our colleagues, they come and they present. We are going to begin with subclass 2, which is a hammer malady. We have Dr. Patricia Hatherley from Australia, who is coming in February. She's going to be talking on the lac remedies. We're very happy to again host our second international speaker after Mikhail Yakir. Mikhail Yakir is going to have one more session in Jan. She's going to finish the Velvicialis, and she's going to move on to introduction to conifers. So we are also very happy for this opportunity to speak about our work.
Also, I think I think in the Facebook we got more than more people shared the video as well, and in the YouTube we have so many
And
participants. So I think the session was unique, and this kind of small sessions are
yes,
which
I
the
agree
people,
completely. It was
yes,
very
which we encounter daily in our practice.
Yeah, yeah, yeah. And it's very important to keep this in mind. The ideal case where you will give one single remedy and huge changes happen and you're learning about the remedy. This is probably this COVID time is not a time for that. You will be getting a lot of acute cases. You have to manage end stage. You have to manage simple things on the phone, on Zoom call. You can't go, you can't meet them. So, your patients will come with a lot of these things. And homeopathy again, steps up, does everything and more than it promises. So
Yes.
I also wanted to say that Dr. Mahesh Gandhi will be doing, his live sessions are once a month with us on Vitalia, and the other on Thursdays. And on the other Thursdays, his pre-recorded sessions will be there. So those also you can reach out to us to
Yes.
enroll and to watch. And thank you so much, Dr. Deepu, for this
Yes.
opportunity, as
And
always.
thank you so much, ma'am, for being with us, and such a nice session you have taken. I think most people need this kind of sessions in the pain remedies, and everybody should know that every method is unique, and we should learn more about each and every, because little knowledge. We will we will get an enthusiasm while going through these kind of methods, because when we are failing in one method, we have to look for other method. When then only we will try to improve ourselves. So I request, and please follow Vitalia channel and PEM method. It's a
Oh,
very
thank
good
you so
method.
much. Thank you very
And
much.
thank you, and thank you all people, doctors, the students and whoever joined in our YouTube, Facebook, and Zoom. Thank you to all.
Thank you for
And
giving
this
time on
will
a Sunday and being here. So we are very thankful for that. And
thank
uh,
thank
thank you so much.